Hello everybody, I am Dr. Ranveer Singh Choudhary, Consultant Nephrologist, Bhandari Hospital, Jaipur. First I will introduce myself. I did my MBBS and MD from SMS Medical College, Jaipur, and then I did super specialization, that is DM in Nephrology from Bombay Hospital, Mumbai. Today we will discuss about kidneys and chronic kidney disease. First we will discuss what are the function of kidneys and what are kidneys. We have two kidneys in our body. They are bean in shape and they are size around mangoes. One kidney have 1 million nephrons, so in our body we have 2 million nephrons, and nephrons are the functional unit of the kidney. So the next question is, what are the functions of kidney? And the main function of the kidney is to remove the waste product, that is toxins, from body through the urine. Other functions are to control the blood pressure, to control electrolyte and acid-base balance. They form the active form of vitamin D, and the most important, they have very much role in to formation of the hemoglobin by producing a hormone known as erythropoietin. Then we'll discuss what are the symptoms of kidney damage. It's very unfortunate that there are no specific symptoms pertaining to kidney damage. And the symptoms which are specific, they appear only in advanced stage of kidney damage. And vague symptoms like lack of appetite, lack of sleep, anorexia, nausea, vomiting, itching over body, they appear also very late stage. Other symptoms like less amount of urine, oliguria, more urine, frequent urine in night, that is called nocturia, red color urine, swelling at legs, swelling around eyes, and increase in the blood pressure. These are the main symptoms pertaining to kidney damage. Then that is what is CKD. CKD is only when the kidney damage is chronic, means if it is more than 3 months, we call this chronic kidney disease. And that's the prevalence of the kidney damage, that is prevalence of CKD, is more, around 3% all over the world. Then we'll discuss what are the causes of kidney damage. Diabetes and hypertension is the most common cause of kidney damage. I can say around 40% of CKD patients are due to diabetes and hypertension. And the relation between hypertension and kidney is just like chicken and egg. We don't know whether hypertension is due to kidney damage or kidney damage due to hypertension, because hypertension causes CKD and CKD causes hypertension. Other causes is renal stones. In India, pertaining some western part of the India, kidney stones are also main cause of chronic kidney diseases. Other causes are infections like malaria, leptospirosis, hantavirus infections, hepatitis B, hepatitis C, HIV. They also causes chronic kidney diseases. Other infections which are rarely like UTI also causes kidney damage, mainly upper urinary tract infections like pyelonephritis. Other causes of chronic kidney disease are diseases which are inborn. We call them congenital anomalies of the kidney and urinary tract. The short form is CACT, which usually produces the CKD in children. Other some hereditary diseases like autosomal dominant polycystic kidney disease, autosomal recessive polycystic kidney disease, they can also causes chronic kidney disease. Other causes like medicine, nephrotoxic medicine, and the most common is painkillers. Many painkillers for routine and headache, body ache. These painkillers, they are very common in use, and the painkillers are kidney killer. They kills the kidney. And other nephrotoxic medicine, some herbal medicines which are usually used in the Chinese herbal medicine. In some part of the Chinese, we call them Chinese herbal medicine. They also causes chronic kidney diseases. And lastly, some systemic diseases, chronic systemic disease which are running in the body chronically, like systemic lupus erythematosus, rheumatoid arthritis, liver cirrhosis, some sort of vasculitis, mainly small vessel vasculitis, they also can cause chronic kidney diseases. Then we'll discuss what is dialysis and why it is required. Dialysis, the word dialysis means to remove. Dialysis is required when kidneys are unable to remove the toxin and waste products from the body. Then by the dialysis, we have to remove these toxins from the body. It is of two types, peritoneal dialysis and hemodialysis. Peritoneal dialysis is a procedure in which we administer the fluid around in peritoneal cavity. The fluid will remain in the cavity for few hours and then we'll remove the fluid, and the fluid will be full of toxins, because the time duration in which the fluid was in peritoneal cavity, there are exchange between the blood and this fluid of the toxins. And second is hemodialysis, that is slightly complicated, because in which we use a machine in which the blood from the patient will come out around 200 ml per minute of the blood. This blood will go into the machine in a dialyzer, and it will be cleared by the dialyzer, because in the dialyzer the blood will be contact in a fluid that we call dialysate fluid, that is pure fluid. The toxins will move from the blood into the dialysate fluid, and this pure blood will return to the body. That is called hemodialysis. And when it is required, I already have explained, it required when our kidneys are unable to remove the toxins and excess fluid from the body, then dialysis is required. The next option for treatment of kidney disease is transplant. And actually I would say transplant is the treatment of choice, and transplant is required when the survival of the patient without dialysis is impossible. Then it is better that patient should go for renal transplant. And for transplant, patient will need a kidney, because a human being required human kidney only. We cannot transplant an animal kidney or a monkey's kidney into the human being. A xenotransplant is not possible because of the antigen dissimilarity. The kidney will get rejected immediately on table. And who can be a kidney donor? Any patient, either a male or a female who is more than 18 years of age, don't have diabetes, don't have kidney problem, and don't have any other major cardiovascular or lung disease, fit for anesthesia, because transplant is a surgery in which the donor will also go for the anesthesia and a major surgery called donor nephrectomy for 3 to 4 hours. So he or she should be cardiopulmonary fit to tolerate that anesthesia. They can donate a kidney. And then the next question will arise, is there any side effect of kidney donation? As such, there is no side effect of kidney donation, but there are still 2 or 3 risks, and the most common risk is that I have explained you, the risk of anesthesia, because death have mentioned with the removal of a teeth also. So any surgery during which a local or general anesthesia required, danger is there, risk is there. During tonsillectomy, tonsil is a minor surgery, but during tonsillectomy some patients have expired. So the first risk is anesthesia risk. Second risk is that you will have a around 12 centimeter long scar mark on your flanks, and that will be visible. So if a donor want to go in the modeling and another professional, he can't go, because there will be a smart mark and the body contour will be slightly deviated because of that scar mark. And the third risk is, although we cannot say that risk, is that you are traveling without stepney, because when you travel with a car, you have a stepney. Suppose one tire get punctured, you can replace that tire with a stepney and you can go. And now you don't have stepney, you have only one kidney. But the problem is that 99% of kidney diseases usually come in both kidneys simultaneously. So it doesn't matter whether you have one kidney or 2 kidney. The disease which have come in a donor after donation, which would have come in both kidney, patient had both kidney. So that risk is not so much risk. That risk is only apply when the kidney damage is due to stones, because usually stones come in one kidney, and then that is the problem. That is a rare chance. And the last question is that how to prevent kidney damage. That's the most important, because in kidney diseases there are no cure. You can't cure a kidney damage. Just like you have malaria, you took anti-malaria for 10 days, now malaria is cured, now you can go. Kidney problems are only controllable. So the diseases which are controllable, prevention is always better than cure. So how to prevent kidney damage? Yes, the most important question, if you can prevent diabetes, or if you can prevent hypertension, you can prevent 40% of the CKD population. So how do you prevent the diabetes and hypertension? healthy lifestyle. Control your weight. No, do not smoke. Do not take alcohol. Do not take painkillers. Do not take the medicines. The composition of the medicine which you don't know. They are not time-tested medicines. Some local Baba and some bhasm, like these bhasm which are usually given by some Babas and some quacks. These bhasm contain many heavy metals, and these heavy metals are very toxic to the kidney. So don't avoid them. Second thing and most important is consult your nephrology at early stage of kidney damage. The main problem is there. People, even in general physician, they don't understand. They don't know when to refer a patient to a nephrologist. If you have diabetes, if you have high blood pressure, if you have leg swelling, if you feel swelling at around, if you are noticing that after a 3-hour trailing your legs are getting swollen and there is socks mark on the legs, means you are getting swelling at the legs. If there is frothing in the urine, if your urine is red color, if there is pus cell in the urine, or there is RBC in the urine, means you have some kidney problem. Consult your nephrologist at early stage of the kidney damage. When your creatinine is a test in the blood by which we measure the kidney function. The maximum normal limit is 1.4. I tell you only 3 things. If you have high blood pressure, if your creatinine is more than 1.4, and if in the simple urine you have albumin or protein trace or 1+ or more, and you have RBC in the urine, you have kidney disease. Please consult your nephrologist at this stage, so you can prevent the kidney failure. Thank you very much.